Hello, everyone. Welcome to the My HR Genius webinar series, the My HR webinar series. This is Kevin Mosher. I'm a labor and employment attorney at Thompson Co. I'm going to be a labor and employment specialist, in fact, and I'm excited to talk about our annual webinar that we do. So we've been doing this webinar series for, I think we've been doing this exact type of topic 8 years now. So pretty excited about it. Always like doing this retrospective and prognostication type of webinar, and it's especially exciting to do it when we are with a brand new executive administration coming in, just because there's going to, especially when the parties switch, there's likely to be a lot of changes, so there's always a lot to talk about. So whether you like the changes or not, I'm agnostic on it, but change is something that all of us at the HR and labor and employment realm need to track and be aware of, and so there's just a lot that's going to occur, that's already occurred, and that's going to occur in the next, couple of years, really. But we're gonna prognosticate about it. So, like I said, my name is Kevin Mosher, and I'm excited to speak to you today. This webinar is being recorded, and so if you want to watch a rebroadcast of it, you are welcome to do so. We'll post it at the myhrgenius.co website, where you can also find out information about our monthly subscription legal service plan, and you can also get information about our HR tips of the week that we send out, and all the other things that we do. Couple of just items. If you're new to the webinar, welcome. Thanks for attending. And there is a little Q&A type of feature that if you have any questions along the way, you're welcome to type it in, and I will try to get to those as we have time and it makes sense with breaks. If you are in need of your CLE or HRCI SHRM credits, and if you did indicate as much when you registered, you should get a certificate emailed from us in the next week or so. Once we've confirmed attendance, we always have to confirm everybody's attendance first. And if you didn't check that, but you do need like your SHRM or HRCI credits, then just go ahead and email us and at myhrgenius@thompsonco.com, and we'll make sure to get that certification out your way. Okay. Oh yes, here's a picture of me pre-COVID. Have to probably get one post-COVID sometime here in the future. Here are the different tiers for the My HR Genius subscription program. It's a month-to-month program, and base cost is $79 for as many emails and phone calls as you want to our legal team about any of your HR or labor and employment type of questions, strategy development, that sort of thing that you need. And we have enhanced programs as well, and anybody is welcome to jump up to those programs, and there's just a lot of extra legal services at very, very affordable, reasonable rates that are included with the other additional services. Okay, so today, what are we going to talk about? We are going to go over the hot topics for 2020. So COVID is influencing everything, right? It's going to influence 2021. It's probably going to influence 2022. It certainly influenced 2020. I don't think I'm saying anything that everybody doesn't know already. So COVID is a day-to-day thing. It is if you were not busy as an HR person in 2020, congratulations. I doubt that's the situation. If your company or organization or government agency did not appreciate you in 2020, maybe consider going to another one, because HR people should have been revered in 2020 for all the work that they did with remote working and masks and it'll be vaccinations in 2021, 2022, and dealing with the FFCRA and dealing with downsizing and layoffs and people use the word furlough. I hate that word, but anyway, furloughs, that sort of thing. HR people, were worth their weight in gold, I think, in 2020. And of course, I'm completely biased on this subject. So, but again, we're going to talk about 2020, and we're going to talk about the FFCRA in particular, and we're going to talk about just other, workplace issues that arose. There wasn't, outside of COVID, I don't think there was a lot to really talk about, to really focus on. Obviously, President Trump did some of the President Trump type of things. Courts kind of overturned most of the immigration things and stuff like that. So there just wasn't a whole lot that actually substantively occurred outside the FFCRA and then COVID-related issues. So we're not going to dwell too much on the non-key things. And then we're going to talk about 2021. And 2021 is in many ways going to be more of the same, but it's also going to be different. We have a new administration. It's going to be I expect, a 180 from the previous administration. And so with that, we need to understand, what does that 180 look like? A lot of this is going to be speculation. The Biden administration, hours ago, I should say the Biden administration, Congress, hours ago, Democrats in Congress introduced a new immigration reform bill. We need to understand what that looks like. That's going to offer a path for citizenship, but it's going to do a lot more, I expect. And how are these bills going to go anywhere? It's a 50-50 tie in the Senate. So it's very, very, very difficult to say with any sort of certainty that legislation is going to occur. More likely than not, we're just going to see a continuation of what we saw with in the Trump administration, which is a lot of executive orders, just executive order after executive order after executive order. And that's mainly because Congress couldn't do anything or agree upon anything. And I don't know if it's going to be all that different, even though the Democrats, control both the House and the Senate. 50-50 is, it's hard to say that's control. So if anything is of serious controversy, like immigration reform would be, then I think it's very hard to predict that it's going to occur. But we will see. Maybe there'll be a lot more compromise and more stuff will get done. So we're going to talk about a lot of projecting and prognosticating and what that might look like. But again, I'm just kind of guessing a little bit on this stuff. But I will say, last year, what I did not guess was COVID. So when we did this topic last year, early in 2020, I obviously had no idea. Talked a lot about paid time off laws, but did not foresee that COVID would monopolize our lives to such an extent, and still is today. Okay, so the FFCRA. I bring this up because, well, first of all, this is a retrospective, and we're looking at 2020. And the FFCRA was an incredibly substantive law that occurred. And I assume I'm not going to get too deep into the FFCRA because I assume everybody on this call is pretty familiar with it and had their fill. And if you're not, I've done multiple podcasts and seminars or webinars on this topic, and you're welcome to go to the mychairgenius.co website to find all of them for more detail on the FFCRA. Also, we're not clear right now on the FFCRA if it really has much in the way of validity going forward. It's voluntary right now. So it's voluntary through the end of March of 2021. But in 2020, the FFCRA was a big deal, and the FFCRA was basically hugely substantive law that was created on the fly in hours. I'm kind of being facetious, but not really. There were no hearings on it. There was no nothing. It was basically backroom written by a bunch of staff members, and then came out and offered billions of dollars in paid time off to employees who triggered any of the 6 circumstances that trigger FFCRA entitlement for paid leave. And then the employers who offered the paid leave under the criteria set forth in the FFCRA were able to apply on their quarterly FICA taxes for reimbursement from the Department of Treasury. Pretty complicated, pretty amazing actually that the government was able to pull it off and that employers were able to get reimbursement. Still very difficult for a lot of smaller employers, the cash flow issues and all that, because there was a delay in the reimbursement. But for a lot of employers and for a lot of employees, it offered the employers the ability to give these employees paid time off so that the employees could spend time with, either dealing with their own sickness or getting COVID testing or dealing with the absences of their children from daycare or schools that were closed due to COVID. And obviously there's a lot of, documentation rules and all that. And again, details, you can go and find those on previous webinars. But that expired at the end of December. So December 31st, that expired. Now, in the last days of the Trump administration, there was I hate to say the word tiny stimulus, because I think it was like $600 billion, right? But in these days, that's tiny. And most people just focus on the checks that they get, right? So you get some money for the government. It's like, great. And so people got their checks, and that occurred in early January. So with that early January stimulus, let's just call it a baby stimulus, which again, $600 billion is a baby stimulus. So the baby stimulus included a voluntary extension of the FFCRA. So a lot of employers, have continued to offer FFCRA benefits. There's no real major downside to it. I mean, they're getting reimbursed by the federal government, again, up to including the rules under the FFCRA. But a lot of employers have also taken the opportunity to say, no, you don't get the 2 weeks of paid time off, and you don't get to continue to stay home with your kids and get 2/3 of your pay for weeks on end. So I think most employers have probably done away with it and haven't voluntarily continued it, but a lot of employers have. And they can do so through March 31st. I mention this all because, first of all, it was a huge thing in 2020. And then second of all, we're going to talk about with regard to 2021 because a renewal of the actual non-voluntary nature of the FFCRA is very much on the table in the Biden administration's $1.9 trillion stimulus proposal. And so when you see $1.9 trillion, that's why we can call $600 billion a baby stimulus. Okay. But I think we could all of us could probably agree that $600 billion is a lot of money. Guess it's all relative. So, okay. So the second topic, again, COVID related, that occurred in 2020 that we all need to familiarize ourselves with is what does it look like if we're going to continue to operate in the middle of a pandemic? If we're going to have employees coming into the office, coming into the warehouse, working on the floor, what is that going to look like? Obviously, so the federal government has issued a lot of guidance, right? So during the Trump administration, and really also so far during the Biden administration, there's been a lot of guidance. The guidance primarily comes from the CDC, but then also we have the Department of Labor through like OSHA also offering guidance for employers who want to continue to operate in the middle of a pandemic. And so OSHA's got great manuals and guidelines for employers and what is, what are essential workers and all that sort of thing. But the CDC doesn't actually say, thou shall not open. That comes down to states. And that's why we've had a hodgepodge of states who have had various laws. In Minnesota, where I am, for example, I think we probably have the complete, Minnesota, California, New York, complete contrast with what we have in, for example, Texas. So in Minnesota, in Texas as a state, I know some cities in Texas have their own thing going on. But in Minnesota, for example, we have been under an executive order, off the top of my head, I think it's executive order like 2040 or something, that basically says no employees can come into the workplace, can be forced to come into the workplace if they can do their jobs remotely. So that puts the burden on every business in Minnesota to have to articulate to the government, if the government comes around asking, why these workers are working here at the warehouse, in the office. It's pretty obvious if it's a restaurant when the restaurants are open, which isn't all that often the last 9 months. It's pretty obvious that, to serve food at a restaurant, you need, the wait staff or the host or something needs to be there in person. It's not as clear, though, with office workers, with other, white collar workers. And so here in Minnesota, and I think in California and other states where they have these sorts of executive orders, I think a lot of people are still working from home. And I think that's going to be like that here in Minnesota for quite a long time. I think a lot of businesses are going to probably spend through the summer working from home primarily, if not exclusively. So we have to look. So again, we have guidance from the federal level, but we don't have. But then we have to look at our state level. And every state and municipalities as well can have their own rules around this. So we need to understand what those rules are and everything. But as a general rule, and I mentioned this, in the past on every podcast and every webinar that I talk about on this, you have to understand you get to set. It's your property. And you have the right to determine who comes onto your property and who doesn't, and what the terms and conditions are of that. Now, obviously, there are some restrictions. We can't be discriminatory, and we have to accommodate if the person's got a disability, things like that. We can't, tell people who are in a protected class that they can't come on the property because of their protected class. But we can, but setting aside all of those sorts of, exceptions that we need to know, you can say as a business, if you want to come and do business with us, if you want to come and work for us, you need to wear a mask. Now, some of the governments might require that anyway, but forget the governments. You as a business owner, as a property owner, you have the right to say, if you employee want to come and work, you need to wear a mask. You employee, if you want to come to work today, you need to have your temperature checked, right? So, there are a lot of things we can do. There are, again, some restrictions. There's a line that we can't cross. We can't do medical exams, that sort of thing. But a temperature check's not a medical exam. So you can, and wearing a mask isn't a medical exam. You can, as an employer, set these conditions. As a result, when employees don't, or guests, when employees don't follow the guidelines, the rules that you have, then there can be consequences. There can be termination. Strategically, what are you going to do if the employee refuses to have their temperature checked, refuses to wear their mask? Maybe we'll talk about 2021, refuses to get vaccinated. What are you going to do as an employer? Are you going to fire them? Are you going to suspend them without pay? Are you just going to ignore it? So we have to understand why we are having these rules. And a lot of employers, if it wasn't required by state or local law, should have had some sort of preparedness plan. And if you're looking at 2021 coming back to the office, you should have some sort of preparedness plan and protocol in place for making sure that you have a safe workspace and that employees can report things, and that they, what to do if the employee feels sick or if they feel like they've been exposed to COVID. What should they do? This should be a sort of preparedness plan that your HR people work and distribute to managers and work with upper management so that everybody's on the same page of how you're going to approach these issues and what needs to happen to make the workplace safe for everybody to come back to work, because that's what we do. And I think a lot of people want to come back to work. I know a lot of people are probably just dandy working from home and all that, and they're just great and their jobs work great with that. But I think a lot of people also want to get back into the office. Okay, let's talk about 2021. And I might ramble on a couple topics that aren't on these slides, so just bear with me if I go. It's not accidentally tangential. It's going to be intentional that I maybe go off a couple of these slides. Okay, so let's talk about the Biden administration. So every 4 years, it is so exciting that I get to talk about the next, the new incoming presidential administration, because it just means that there are going to be changes, and changes are, interesting to talk about and learn and all that. In many ways, I think the Biden platform is basically the Obama platform, part 2. And I I look at the platform. I look at what Biden wants to do with regard to a lot of labor and employment laws, at least with regard to the platform. And it really just kind of looks like President Obama's platform. And we're all very familiar, or should be, if we've been doing this long enough, very familiar with the actions that President Obama took with regard to the Department of Labor and the EOC and independent contractors and all that. So I think we do have kind of a roadmap for what a President Biden administration might look like. And I really, with these President Biden photos, I love the aviator glasses. I really, in the future, I gotta find pictures with the aviator glasses, because I always think that's like a super cool, cool guy look. So, okay. So here is the Empower Workers platform. I don't think anybody would, President Biden has said as much that he wants to be the most pro-worker president of all time, or pro-union worker president of all time. That mimight be. I don't think it means that unions are going to necessarily, be roaring back and into overdrive and start taking over as a enormous percentage of the workforce. So it might be as much politicking as anything, shocking, right? But he's saying it. So he's saying that he wants to be big pro-union. He wants to be pro-employee. And we're definitely going to see a lot of pro-employee, right? And so this is a complete contrast to what we had the last 4 years of the Trump administration. So I think we can fully expect that we're going to see a lot of pro-employee laws coming out of the Biden administration. A lot of changes at the administrative, at the EOC level, at the FTC level, at the NLRB level, that are at the DOL level, that are going to directly impact regulations. There's going to be new regulations. They're not going to come out right away. It's going to take time. Same as it did with the Trump administration. Often the importance of getting the second term is because it takes so long to get these regulations going. Once you put them together and you negotiate and all that, and then you put them together, and then you have to have comment periods. It takes a long time to do this. And if you take a look at President Obama, most of the regulatory changes didn't occur until the second administration. There were a bunch of legislative changes that occurred in the first President Obama term, for example, you've probably heard of the Affordable Care Act, right? So the Affordable Care Act was in the first term. But the executive orders, the regulations, those all occurred in the second term. And that's why, President Trump was starting to get going on a lot of regulations, and including some independent contractor regulations, which he just didn't get out in time. And then President Biden, like day 1 or 2 or whatever of his term in office, got rid of them. So, struck all non-emergency regulations. So everything that President Trump was unable to actually get into effect through the process, President Biden just basically wiped it off the map. So none of it, it doesn't really exist any longer. So a lot of work for nothing. But now we're going to have a lot of work in the opposite direction, I expect. So, okay. So let's talk about the biggest topic right now, which is vaccines. I'm sure you've all heard on this topic. I have done many podcasts, some my own, some for, SHRM and other organizations, and I find it to be a fascinating topic. I think it's going to become a very frustrating topic as well. But let's just talk about vaccines. And if anybody wants specifics on vaccines, I've done a number of podcasts here. Again, myhrgenius.co. You can see the webinar that we did last month on the topic, as well as the podcast. You can find the podcast there where we talk about them quite a bit. So, yes, employers can mandate vaccines. I don't think there's much question on that anymore. I think most people get that, that you can do that. But the big question is, should they? So should an employer mandate that the employees get the vaccine? And this is going to be the answer to that is going to be company by company. I personally think that you're going to find more employers in the healthcare sphere industry, in healthcare, especially where they're doing direct patient care, and in including long-term care facilities, hospitals, that sort of thing. So nurses, doctors, long-term care, like LPNs, that sort of thing, are much more likely. Not everybody's going to do it, but I think they're much more likely to mandate that the employees that are performing direct care services get vaccinated. I also think it's going to become, when it becomes available, and in most states it's not, beyond the healthcare industry and beyond some at-risk or older citizens. Most states aren't, they're not beyond that, right? So they're still in like phase 1A, 1B in most states, but every state's different with their allocation of the vaccines and how it's being distributed. So you can't just say, well, what's happening in Minnesota is the same as happening in Texas. That's obviously not the case. Although the same thing that's happening in Minnesota is kind of happening in Texas, which is cold weather and a lot of snow. So too soon probably for those of you in Texas, but we hear you. But on the vaccine front, things are very different in Texas than they are in Minnesota, as they are in New York, as they are in California, as they are in Vermont, as they are in Illinois. So vaccine distribution, everything is all very, very, very different. But the point is, when it becomes available, and employers need to have this conversation about mandating. I think it's good for employers now before this is even. Obviously, it's been a topic for the last few weeks for healthcare employers, but for everybody else outside healthcare, it's going to become a topic where you're going to have to address it, right? So when the vaccine becomes more readily available in the spring and in the summer, where you could say, I'm mandating that you typical employee, 35-year-old who's healthy, you have the opportunity to go and get the vaccine. Then in that situation, I think, and I should forward this slide as I just sit here and talk. In that situation, I think you're going to have a serious conversation strategically about what you're going to do, because right now it's just hypothetical for most employers. So here are a lot of factors to consider when you're considering whether or not to mandate it. And again, beside the healthcare industry, I think a lot of employers are going to have the opportunity to say to their customers, hey, we're vaccinated. And I think my understanding from what I read, again, not a doctor, is that even if you're vaccinated, you could still be a carrier of COVID, so you could still spread it. I don't know if that's true or not, but that's I think what CDC is saying right now. So this might not matter all that much, but I think if I was in hospitality, if I were in the airline industry, travel industry, I would seriously think about mandating that all my wait staff, that all my cleaning staff, that all my stewards and stewardesses on the airlines, that they all get vaccinated. Because, well, first of all, I don't want to deal with disruptions in the workplace because they're getting sick and they're getting COVID. Maybe they're making a work comp claim, depending on the state that they're in. I don't want to deal with that risk, right? There's a lot of risk in putting people who aren't vaccinated into positions where they are having direct customer, person-to-person contact, and they could get COVID, they could miss time, they could get sick, they could die, all these things. They could sue you, all these sorts of things. So we don't want to do that. So I think mandating in those situations where you're a much more at-risk population for being exposed, that it makes just a lot more sense to consider mandating. So I expect hospitality, travel, and other customer-facing industries might think about mandating, at least for some people that are customer-facing at those businesses. So that might be one of the things. But then everybody else, the question is, okay, I don't want to mandate it. That's not me. Live and let live. If people want to get sick, that's on them. I'll just take the risk. Everybody else, then what are you going to do? Are you going to say anything about it? Do you want to promote it? Do you want to encourage people? If you want to encourage people, what does that look like? Is it going to be incentivizing them with money? Are you going to give them gift cards? Are you going to give them bonuses? How are you going to do it? These are all, and those, by the way, are W-2 issues, right? So if you give a gift card, it's going to have to be counted in the regular rate of pay for non-exempt employees. It's going to be W-2. Are you going to give PTO? That's easier to do. Are you going to give them a day or 2 days off? What's the incentive? And then what are you going to do when a serious percentage of your employees say that they don't want it, that they're not going to get it? I don't care how much PTO you give me. I don't care if it's a $5,000 bonus. I'm not putting a vaccine in my body that I don't trust. It's not worth it. I'm not going to do it. And so even if you've incentivized employees and you're really just kind of passive-aggressively backdoor trying to get everybody to comply, what are you going to do with those employees that don't? Are you going to eventually, tell them that they can't continue to work for you, that they can't continue in their jobs customer-facing? There's just a lot of strategic things that the C-suite or ownership at the company really need to be considering. And here's just, again, on this slide, here's a number of the factors that would be considered. But again, every business is a little bit different. You might have other factors that you would look at. But there's going to be, as more and more people are opening up the restaurants, they're opening up the hotels, they're opening up their offices, there's going to be, the pandemic's not going to go away. I mean, COVID's not going to go away. It's going to be out there. So people, unless they're vaccinated, assuming the vaccines work, unless they're vaccinated, they're going to continue to get sick, and maybe as high of a rate or higher even, who knows, as we start to reopen across the country in more states than already are open. And right now, we've got a long ways to go. Last I saw, it was like, because there's the current vaccines that are in use that are being distributed are double doses, and I think it's like just under 5% of the U.S. population has been vaccinated. And that less than 5%, those are probably people that, are fairly sophisticated. They're healthcare workers, they're older people in some states. These are people that are, wanting to do this. We're going to cap out at some percentage. I don't know what it's going to be. What, 70%, 80%? The government's not likely to mandate it. So what happens when 70 or 80% of the people have the vaccine and the other 20 or 30% don't? But all the businesses are reopened and everybody's facing. I mean, those 20 to 30% are just going to continue to get sick. That's a serious percentage of your workforce. So anyway, these are all a lot of things to consider, and I believe that's going to be the biggest topic of 2021, how to deal with the issue of vaccinations in the workplace. Okay, moving on from that a little bit. So returning to work, and again, vaccines I think are just going to be part of all of this conversation. But returning to work, so one of the things we need to do, and if you're in a state of like Minnesota where it's mandatory that you had a preparedness plan for returning to work, then that's great. I think it's just something, like I'd mentioned before, I think it's really something that all the businesses should have strategic conversations and protocols and risk assessments for returning employees to work. And these are the considerations that you would do. And then you want to implement, again, in like Minnesota, we have mask mandates. There are exceptions and nuances to it, and I think that's common around the country. A lot of states don't have any mask mandate, but whether the state has a mask mandate or not, you as a business owner can implement infection prevention measures. That might include mask wearing, that might include hand washing. You might provide sanitizer at every desk or workstation or sanitization station. You might change your procedures so that people aren't touching the same machines or items as much, so for example, I go to the gym, right? And so every time anybody at the gym uses something, they're supposed to wipe it down and sanitize it, right? So, obviously that's not something that was a courtesy before. Now it's a mandate to make sure that the gyms aren't spreading COVID around. Businesses are the exact same. So you might just need to, if you haven't done it already, you might need to implement a lot of procedures for ensuring that the workplace is as safe as possible. And again, there's no mandate on this, at least at the federal level. Your states might have mandates on these things, but at the federal level, we don't have a mandate on any of this. Temperature testing, you might require temperature testing. And again, what are you going to do if the employee says no? Saliva testing, I don't think a lot of people are doing that. I mean, I've heard some people are doing the saliva testing, but I don't think as many people are doing it. It's a lot easier to just get COVID tests now and to get those results within 24 to 48 hours. So I think that's much more common if employees are experiencing symptoms. And that's another thing, your protocol for returning to work. What happens? Who's going to make the decision if the employee is experiencing symptoms that are related to COVID? So what are you going to do? What's your protocol for it? What are the employees expected to do? How are you communicating with employees? Who do the employees need to communicate? These are all things that need to be laid out in a policy or a plan that should be, with some aspects, communicated to employees. And I think employees are going to appreciate it. A lot of employees have not wanted to return to work and are continuing now going to want to return to work. They're scared for themselves. They're scared for others. Sometimes rightly so. Sometimes it's a little exaggerated. But employees, this is very personal to most people. And the way that you approach this pandemic and your job within the pandemic is people feel very personal about that, rightly or wrongly. And they just, you might not like the government telling you what to do. You might not like the business telling you what to do. But I'm here to tell you that as a business owner, you get to tell people what to do, whether they like it or not. But anyway, thus the friction. Okay. Double slide mistake on my part, but I will say this. There are exceptions if you do go with the mandate. There are exceptions that if the employee has, if they have a disability or they have a sincerely held religious belief, that in those situations they can accept themselves from a vaccine mandate. And again, they have to have a disability that prevents them from getting the vaccine, might make them sicker, might endanger them, whatever it is. And then if they have a sincerely held religious belief, and again, just the opinion that they don't like vaccines, that's not a sincerely held religious belief. That being said, I don't like getting into conversations and determinations as to what an employee's religious belief is and whether it's sincere. And so I don't recommend that HR professionals get into those conversations without legal counsel, because obviously, it's just who wants to sit there and argue over, with an employee who's very passionate about their religious beliefs over whether they're sincere or meet the criteria under federal law. I suggest getting legal counsel involved and trying to work it out that way. There seems to be no good upside to getting into that argument with employees. Okay, the Biden stimulus proposal. So right now we've got on the table a $1.9 trillion stimulus proposal from the Biden administration. It has been, I believe, passed by the House and is sitting at the Senate. And I think that phrase, like passed by the House, sitting at the Senate, is probably something we're going to reiterate quite a bit over the next 2 years at a minimum, maybe 4 years. So the $1.9 trillion is sitting there waiting to go. And so, what are some of the, besides the money, and I think the direct payment to people is $1,600? I don't know. Anyway, it's like a lot of money, but it's more than you got in last time from the baby stimulus, and I think it's even more or about as much as people got when the first stimulus occurred in March, April, like in that time frame. Anyway, so I think it's around $1,600. That's the proposal, but that's not what's important to us, unless you get it. Then in which case, then it's like super important. But that, for discussion purposes, that's not what we're here to discuss. So what we are interested in is what else is in that stimulus proposal, because it's not just $1.9 trillion, it's a lot of other things thrown in. Now, a lot of these things might be thrown out as well, mainly the minimum wage increase. So, right, who thinks the minimum wage increase is a political hot potato? All hands should be going high. I will say it's not as much of a political hot potato or as it used to be. But 10 years ago, when the whole, $15 raise minimum wage thing, that was kind of laughed at, right? But now we have, I don't remember the exact number, I want to say like 27, 28 states. Anyway, most states in the Midwest and Northeast and West Coast, so pretty much everybody except for the South, has raised their minimum wages, and a lot of them are going up to $15. Now they're incrementally going up slowly, but a lot of states are making their way right now to $15 an hour for a minimum wage. Obviously, a lot of people, another half of the country or so, are not on that same path, and their minimum wage, so like in Texas, for example, the minimum wage is like $7.25 an hour. If this changes, if this stays in the Biden proposal stimulus package, then we're going to look at a gradual increase to $15 an hour as a minimum wage across the country. And again, for about half of the states, that's not going to matter at all. But in, the states in the South, it's going to be a big deal, because a lot of them have $7.25 as their minimum wage. One of the big parts of this is going to be no more tip credit. So, yeah, no more tip credit. That's a big deal. That's a big deal in the hospitality. Not so much in Minnesota, because we don't get the tip credit on the minimum wage in Minnesota, but it is a big deal in most states. So, like Wisconsin and most every other state, where you can give the tip credit for a big percentage of the tip that can be used to go toward the minimum, satisfying the minimum wage. So yeah, tipped earners in Minnesota end up making bank because they get paid a minimum wage, which is again way higher than the federal minimum wage, and then they get their tips on top of it. So they just do really, really well compared to tipped employees in other states. The other thing the Biden administration proposal would do is to eliminate the subminimum wage for disabled workers. Right now, you can pay disabled workers, you can pay them less. And this is, these are part of programs, but if you're part of a program, you can pay those disabled less than subminimum wage to do the same, type of work. It's an incentive it's really an incentive program to hire disabled workers. Now, the other, and I will say this, I don't think the minimum wage is going to stay in the $1.9 trillion when the Senate's 50-50, and I just don't see it. I don't think it's going to happen. I think that the $1.9 trillion is too big of a deal for the Democrats and President Biden, and the minimum wage is probably the biggest political roadblock to passing that $1.9 trillion package, and I just don't see President Biden allowing the minimum wage to hold up the stimulus package itself. we will see in coming days and weeks. But my guess is that the minimum wage gets tossed as part of a final compromise. Less controversial, somewhat controversial, but less controversial is, I mean, everything's like less controversial than minimum wage for whatever reason, but less controversial is the enhanced unemployment benefits. That's just something that we've come to know. Economists say, and they've done their research, I believe none of it, that the enhanced federal unemployment benefits are not incentivizing unemployed workers to stay home. I think that is not playing out with all the anecdotal evidence I've seen on the ground dealing with companies and trying to get people to come back to work. Way too many, I've heard way too many situations and stories about people wanting to just sit at home and eat Cheetos and not come into work because they're making more money on unemployment than they were making while working. So, and honestly, who can blame them? But I just, when the economists come out and say like, oh, there's no incentive at all, like we don't see any employees, any people around the country, it's crap. I think there it is. I think that's crap. So, but anyway, it's also really, for those employees that can't find work, obviously it's a really important benefit. And so the stimulus package, currently there's a $300 per week unemployment sweetener. It used to be $600 when that first came out last April. And then under the Biden proposal, it's going to go through the end of the federal fiscal year, which ends September, I think, 30th. I think September 30th is the end of the month. That's going to move to $400 per week. I think that's much more likely to stay at like 400 or maybe compromise down to 300. But that's something that's much more likely to stay in this $1.9 trillion package. There's also hazard pay for frontline and essential workers. That would be as part of this package. And then also, here's the big one that I foreshadowed earlier, an expanded FFCRA. And let's talk about that with specificity. And again, this is just through the end of September of this year. So we are now in a voluntary situation with the FFCRA. We would then go back to a mandatory situation, probably beginning, I think, April 1. So April 1, 2021, assuming this all passes and stays as proposed, here's the difference. It would cover all employers. Right now, it's pretty easy to exempt yourself if you have less than 50 employees, and offering the paid time off under the FFCRA would directly, materially, negatively impact your business. So you're able to basically tell employees, no, but we're not going to offer it. Also, employers with 500 or more employees are not covered by the FFCRA. The idea being that they, bigger employers already have their own PTO policies, which sometimes is true, sometimes isn't true. But that's going to all get done away with based on the current proposal, which is that every employer in the United States would have to offer the FFCRA. I believe it also would be a renewed 80 hours on the up to 2 weeks, 80 hours. So a fresh new batch of 80 hours for those, if you have employees who used their 80-hour allotment in 2020, they would get a fresh set of 80 hours. And then also, we'll have to see how that works with the FMLA, but they would likely get the same with the FMLA. It's a little different on the FMLA side, so I don't want to speak too much about that until we see what happens here. Also, no more exemption for healthcare workers. That's a big deal because a lot of healthcare companies and in the healthcare industry were able to say to their direct care workers, no, you can't take time off. We need you here because of the overwhelming need right now that we're dealing with. That denial is not going to be available in the future if the FFCRA 2.0 passes, because it's going to include no more exception for healthcare workers. On the FMLA side, it would also increase the amount of money by $400 per week. So you go up to from $1,000. So right now the max, if the employee can take up to 12 weeks off under the FFCRA, up to 12 weeks off to care for children who are home from daycare or school due to COVID closures, and they can get up to $1,000 a week. So less than they can get under the, anyway, there are other circumstances where you can get up to 100%. But under the school closure FMLA side of it, you only get up to $1,000. That would increase up to $1,400. So your employees who stay home with their kids would get more money. So up to $280 a day versus a max of $200 a day, and it would be increased to 14 weeks. So again, I don't know how that's going to work with the FMLA, because the FMLA right now is 12 weeks, but apparently that's what, we'll have to devil's in the details, so we'll have to see. None of this is passed yet, but I just want to put it on your radar that don't delete all of the knowledge that you have of the FFCRA. Keep it fresh, because I expect it's going to come back. Okay, so let's talk about immigration reform under a Biden administration. For those of you who might need H-1B visas, now is the time. We just earlier this week sent out our HR tip of the week. Yesterday, maybe? I think yesterday. It went out, maybe 2 days ago, went out about the new H-1B registration. Again, just like last year, if you want to sponsor an employee or a prospective employee for H-1B, for an H-1B visa, you need to register, directly, or have your attorney do it, or and call me if you need help with H-1Bs. But that has to happen between noon on March 9th and noon on March 25th. And if you don't register within that window, you will not be part of the H-1B lottery. And every year for like the last 10 years since the Great Recession, more than 10 years, there have been about 3 applicants for every H-1B visa. And so, your chances are about 1 in 3, give or take. But if you want to even be in the running, you have to register between March 9th and March 25th. Again, reach out to me if you have any questions or want to talk about this, because time is running short on this. Also, next year, we will see, it's been delayed until 2021, but next year we will see changes to the H-1B where there will be preferential treatment for higher wages paid to H-1B recipients. So you'll get a preferential treatment in the lottery. We'll see what the details look like on that as we approach the end of 2021. DACA, there is a goal. It has been extended by President Biden, something he did first day of office. But there is a goal to make it permanent. And I think just today Congress introduced I think I've mentioned that before. Congress just today introduced their immigration overhaul, which offers a path for citizenship for DACA, people who are on DACA, as well as dreamers, to become ultimately, over a long period of time, ultimately get to become citizens of the United States. Travel bans gone. Courts had blocked most of the Trump travel bans anyway, as violations of various laws. But anyway, President Biden has done away with all travel bans as part of his early executive orders. Okay, and I say massive overhaul pending. It is pending. It was just introduced. Independent contractors. This is going to be something that we're going to go back. I expect we're going to go back to the Obama administration independent contractor situation, and we need to look at the Payroll Fraud Prevention Act. That is a bill that's been bouncing around Congress. Maybe Congress does something with it, but it basically would change the way that we look at independent contractors in the United States. And if it's done by the Democrats and President Biden, then it is likely going to be more difficult for companies to classify people as independent contractors. And right now, President Biden has stated on the campaign trail that he likes the ADC test that has been went into effect in January of 2020. It's been slightly altered a little bit in more recently, but the ADC test in California, which is a much stricter test for finding somebody to be a legitimate independent contractor. And so, if there's actual legislation on this, it could be a big deal because it'll just make it much, much harder for employers to classify people as independent contractors, which means they have to be classified then as employees, which means benefits and taxes and FICA and all that sort of thing, and the added costs that go along with it, insurance as well. Expect that if we don't get the Payroll Fraud Prevention Act, expect that if we can't get legislation done on it, that the Department of Labor is going to change the regulations. And again, they just undid the Trump administration proposed regulations on the independent contractor test redo, that the DOL is likely to look at the California ABC test and issue guidelines. And if that's the case, the Department of Labor will have much stronger guidance and be able to go after employers for misclassifying employees. And also the penalties might be really enhanced. So if you're misclassifying employees, even if you're not doing it, even if it's accidental and you're calling people independent contractors when they should be employees, the penalties, could be in the tens of thousands of dollars, for just a few employees. So it could be pretty significant if that Payroll Fraud Prevention Act occurs. We are just about to wrap it up, but one thing I do want to talk about is that President Biden has also expressed not liking non-competes, and this is pretty common with among a lot of Democrats as well. And we're starting to see it's been around in California for a while, but now more recently in like Maine and New Hampshire and even Illinois has some laws on this. We're starting to see more states pass restrictions on businesses' ability to restrict workers post-termination, right? So that's non-competes, that's non-solicitation agreements, it's no poaching agreements. And so states are starting to, this is a statewide issue. So it's not clear that the federal government would even have the authority to do it. I think it would go to the Supreme Court if they tried. But the FTC might claim that they have the jurisdiction to publish under the Federal Trade Commission to publish regulations saying that there's like some competitive prohibitions on this, and that so the FTC, if they can't get legislation at the federal level, I think there's a chance that the FTC publishes its own regulations saying restricting employers' ability to, at a minimum, have no poaching agreement, not have no poaching agreements, where you tell employees that when they become former employees that they can't solicit your current employees, right? So at a minimum, I think the FTC is going to consider that. Are we going to get into non-competes and non-solicitation agreements? It's starting at the state level. Several states are going that route, but I don't know if we're going to see that at the federal level through legislation, at least not while the Senate's 50-50 on the issue. And then finally, last thing here is that there is, right now the LRB is 3-2 Republicans, and that's going to stay like that until August when it becomes 3-2 Democrat appointees. But also right now we have in front of Congress the PRO Act, which is the Protecting the Right to Organize Act, and that would be a complete overhaul of all labor laws. And if that happens, that would probably be the biggest piece of legislation during the Biden administration. It would completely, I don't want to say completely, but it would seriously realign what is right now more of a power balance between companies at the NLRB level and at the court level between companies and unions, and it would really give the unions a much a more advantageous playing field in trying to organize and boycott and picket against businesses. And I think we would see a potential expansion of unionization in the United States if this bill passes. But again, this would be something passing like this would be incredibly controversial, fought and lobbied against, and with a 50-50 Senate, I don't see it happening, but we'll see. That's when President Biden says that wants to be the union's biggest fan president, this is what he means. Passing of the PRO Act, there's just a huge amount there, and it would be pretty serious for businesses in the United States. Time's up. Thank you so much for your attention and participation here. And if you have any questions, you are definitely welcome to reach out to me at kmosher@thompsonco.com or call me directly at 651-389-5007. And then next month we are going to have, in March, we are going to have our FMLA ADA work comp and paid leave webinar and how it interacts with a pandemic. So it should be a very interesting topic, and I'm really excited to present that to you. Let me know if you have any questions. Otherwise, have a great month.